Well, hi everybody. This is the Stone Center in Cyberspace, I guess. I'm going to give I think all of our faculty are going to be doing video talks in lieu of what would normally be our summer meeting. And it's sort of obvious that we should be doing things as far as possible related to the current crisis. What I want to do is, if I had a title for this talk, would be an unequally distributed depression, talking about the economic impacts and the form of inequality that we're seeing, which is a little different from what we normally focus on. Although there are some precedents in fields that I've worked in that might not immediately seem related, but I'll explain that in a minute. So this is about where we are, what's the nature of the inequality, and what does it say particularly about social safety net policies, given this heretofore unprecedented experience, but one that may have some lessons for the future. So let me actually start by saying and justifying the use of the word depression. And I'm going to give you a picture here that is a long-run picture of the U.S. unemployment rate, going back to the Great Depression and up to the most recent numbers. Just a couple of words about the numbers in this chart. You still see a lot of people using obsolete numbers for unemployment in the 1930s, the Labor Got series, which it turns out counted workers employed by the WPA and the CCC as unemployed. So the numbers here are the recent estimates, which try to adjust the available data to modern concepts of unemployment. So that's why you see perhaps somewhat lower numbers in the 1930s than you may be used to seeing. And the number at the end there, so the BLS report said 14.7% unemployment, but you needed to actually read the report. They said that they believed that many of their field people misclassified workers who were out of work because of COVID-19, and that had that classification been done right, they believed that the true unemployment rate was around 5 percentage points higher. But that their policy is to take the survey results as they come in and publish it, just for consistency, and not to adjust. So the likely true unemployment rate is in fact about 20%. And that means that right now we have an unemployment rate that is higher than the unemployment rate for most of the Great Depression. There were only a couple of years that were actually worse than where we are right now. So it is depression level unemployment, because they actually had a note explaining that they believed that there was a lot of miscounting of people who were in fact unemployed because of COVID as still being employed. It's not no malice, just a technical thing. And they also said that to maintain previous practice, we're reporting the number that came in from the survey, but we actually believe that the true unemployment rate was probably something like 5 percentage points higher. So the number I'm showing at the end there is 20% unemployment, which is probably a rough guess of where we are right now. And that is Great Depression level unemployment. In fact, it's worse than all but the 2 worst years of the Great Depression. And now, we won't consider this a depression, probably. There's no hard and fast rule about that. But we won't consider it a depression unless it persists for an extended period of time. And that's all about both macroeconomic and epidemiological policy, which I'm not going to get into in this talk. Instead, I just want to talk about where we are right now and basically who gets hurt. Almost everybody gets hurt by this, but who gets hurt, and how do we fit that into the way we think about inequality? Now, the precedent that I have, and I'm going to stay with the slides for a bit here, the precedent that I have in mind is one that comes from international economics, which is my original home field. That field has been concerned about inequality, the effects of international trade, of globalization on the income distribution for more than 30 years. But we blew it. I blew it along with a lot of other people, because in the 1990s, as globalization came on strong, we looked at it, we tried to assess the impacts, but we focused very much on what did it do to relative wages of broad classes of workers without a college degree versus workers with. Basically, so looked at that on a broad class basis. If you like, we were looking at vertical inequality. And what came out of that was that there was, yes, there was some non-equalizing effect of trade, but it was probably modest. It was probably on the order of a few percent increase in the college, non-college wage differential. But that turns out was missing a very important part of the story. Because what happened was that rapid growth in imports of manufactured goods had aggregate impact on blue-collar workers, but it was not evenly distributed. In fact, it was very geographically concentrated. And so that's not quite the kind of horizontal inequality we usually talk about, which is by cultural or racial group or some kind of social distinction, but it's something different from the overall distribution of income as we normally think about it. And give you just quickly my motivating example. One industry that really got savaged by globalization was furniture. It turns out that prior to 2000, there were almost no imports of furniture, a tiny amount of stuff to at Pier 1 or whatever. But there was a large expansion of furniture imports and a large decline in employment in the furniture industry, even before the Great Recession, which from the point of view of the nation as a whole was nothing. But the furniture industry, to the extent it still exists, but certainly before, was highly geographically concentrated. And so my next chart here shows the change in furniture employment from the China shock as a percentage of total 2000 employment. For the US, it's a tiny fraction of 1%. For North Carolina, which is where the US furniture industry is concentrated, it's much, much bigger. For the metropolitan area of Hickory, North Carolina, which was the epicenter of the furniture industry, it was a big, big shock. And people are not as mobile as all that. So it's not the case, in fact, that this is just something that could be smoothed out by labor mobility. This really ripped the heart out of a community. And that's the point, that we fail to think about how intensely localized the shock would be. Well, what we have now is the US economy is I've been calling it an induced coma. We shut down high contact economic activity so far as possible in an attempt to limit the spread of the virus. And then this question, how long will this persist? How long should it persist? All issues that are outside the scope of this, though obviously I've been writing about them in other places. But it's a very selective shutdown. So what's happened is that something like 1/5 of the economy, 1/5 of employment, the door's been slammed shut. The rest is not so much affected. There are some impacts on earning ability, some impacts on convenience of life for those of us who can work from home, whatever. But it's nothing comparable to what happens to the people who are working in sectors that have been fundamentally shut down. And as I was getting ready to do this talk, I was preparing. We only got the job market report on a few days before, and I was preparing to do the best I could to try and get at more of that. But then it turned out that landing on my virtual doorstep was a paper that had done much of the work not using the BLS data, but using ADP, which is a data processing firm that does payrolls for lots of companies, and therefore is able to produce its own independent estimates of private sector employment. And so they were able to use ADP data, which they got access to look at changes, and had already done pretty much all of the stuff that I was going to do. And so I'm going to do some substantial citations to this paper. So here's the paper. It's by a lot of authors. That tends to happen when you're doing heavy data analysis. And it's getting at just about every chart that I was hoping to try and make from the BLS data, and some that I couldn't is in there. So they look at changes between, I believe, mid-February and mid-April, which, by the way, early indications are that this is not a steadily unraveling situation. It looks like things kind of leveled off after a huge plunge in mid-April. So this is kind of right. So let me unshare for a moment and talk about what we know, what I already knew it was going to be the case, which is that the impact is hugely unequal across industries. That you have travel, hospitality, restaurants, fast food particularly, but restaurants, anything that involves personal service, virtually wiped out because of aggregation. I mean, there's some alternatives. Some restaurants are continuing to employ some people providing takeout, probably more so in New York, where delivery services are such a big thing. But huge cuts there, much less throughout the rest of the economy. The extent to which there's a concern among people who are doing the macroeconomics that that there could be spillovers, that because that unemployed people will be liquidity constrained, unable to spend, and that this will bring down the rest of the economy. So far, there's not that much sign of that in the data, and as I'll explain, at least so far, the relief programs that we've instituted are providing some cushioning, significant cushioning against those effects. There was a brief period in March when it looked as if this was about to metastasize into a financial crisis, when financial markets were going haywire and spreads. They basically looked like we were going to have a 2008 style crisis on top of the pandemic. The Fed stepped in with a very large bazooka and bought huge amounts of assets, and also declared its willingness to buy stuff it has never bought before, including junk bonds. And so the financial crisis could have spiraled into something much bigger, but at least for the moment didn't happen. So what we're left with is something which is a very selective crisis. It's something that gets at that hits certain sectors of the economy really hard and others much less hard. So let me go back to a slide here. And here we have changes in employment. Look at the first column only for now, by sector. And well, you can see more than half of employment in arts, entertainment, recreation, accommodation, and food services went away. In some ways, it's remarkable that it isn't even more. Who's going to a concert? Who's going to a hotel right now? But in any case, the really drastic drops there. Percentage terms much smaller elsewhere. There are some of the sectors are very large. Healthcare. Who would have expected that a pandemic would lead to a fall in healthcare? And yet we actually have lost, according to the BLS data, about 2 million jobs in healthcare. That's people postponing things that can be postponed. A lot of that is actually cancellation of dentists' appointments. But it's also elective surgery, just plain doctor's office visits. People are avoiding it. So there are some surprise sectors that are in there. The point is, it's a very sectorally differentiated shock, which means that the biggest determinant of how badly you are hurt by this crisis is not where you are in the income distribution, but what industry you happen to be employed in. It's a much more severe crisis for somebody who was working for a restaurant than it is for somebody who was working in an office job that can be shifted to telecommuting. It's been a very uneven impact, hugely unequal. Now, it turns out, which you might have expected, that these sectoral shocks are correlated with conventional income distribution issues. If you ask, where are the low-paying jobs in America? A lot of them are in fast food, personal service. They are in the sectors that are also, it so happens, are hit. And so this paper found the biggest declines in employment took place in the lowest income quintiles. So in fact, there's a pretty strong conventional income inequality effect as well. This did hit the bottom quintile, but within that bottom quintile, there are going to be, again, enormous differences. It's a 35% decline in employment overall, but it's probably 60 or 70% for those who were employed in the most afflicted sectors. This is very much a sectoral shock where what happened to you depends upon where you were employed, which happens because of the nature of the sectors afflicted, happens to be closely correlated with the overall position in the income distribution, but it's not the same thing. Okay, so I'm going to, sorry, and there is something else I wanted to say, which is that you can really see the shock, the correlation with the income distribution by looking at aggregate wage data. So I'm going to share my screen again and give you now something of my own. In other words, something that isn't stolen from somebody else's paper, but using Fred, our for anything macro and quite a few things sort of micro, our universal data source. This is showing percentage changes per month in average hourly earnings. It's always a number that's some fraction of 1%. That there's a lot of noise in that series. You see the spike at the end, You get a 4.6% increase in average wages. Somebody said that these days every chart looks the same. They all, except this one, it's going up instead of down. But every chart is, well, unemployment looks that way too. There's a sort of wiggle, 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 and then woof, because of this incredible shock that's taking place in the course of just a few weeks. Now, did anybody actually get a 4.6% wage increase, or did any large group of workers get a big wage increase as the unemployment rate was soaring up to 20%? Obviously not. What happened here is that this is a composition effect. The workers who got laid off were disproportionately low-wage workers. And so those who remain have substantially higher wages than the average before the COVID-19 shock. And so that's showing you that we have a huge income distribution effect. Okay, so let me stop slides for a few minutes and talk about policy response and what it says more broadly about where we might want to think about policy going forward. So we've had several things that people persist in calling stimulus bills, which they aren't. This is not a Keynesian slump, at least so far. And the purpose of the bills that have been passed, the bills that have been passed are better, conceptually at least, and to some extent in practice, I'll get to that in a minute, than we might have feared. Again, just a very short time ago, what we were hearing was that the answer to this was going to be tax cuts, which makes no sense at all. Going to reduce the tax that people pay on the wages they aren't earning. It's not a question of inadequate economic activity. We have deliberately shut down the economy to contain the disease. And so what we're actually seeing now is not stimulus. What we're seeing is basically disaster relief on an immense scale. The entire, a very large, it's like, I don't know, 30 or 40 Katrinas hitting all at once all across the country. And so the goal of policy is to primarily to minimize the hardship. That has the supplemental virtue probably of helping to contain the macroeconomic fallout, because there are, to the extent that you can provide relief to people who've lost their jobs and maybe small businesses that have lost, that are on the ropes, then you are able to that they're able to sustain their spending on goods and services that are not subject to the lockdown. But that's secondary. Primarily, it's about disaster relief. Been hard getting that through. In fact, what we're seeing is, I'm watching as I tape this, the discourse is reverting. The usual suspects are back to talking in terms of economic stimulus. There have even been people saying, we should respond to this with a capital gains tax cut, which is okay. But one way or another, the major bill we've had so far it's largely designed by Democrats. It's a mix, but it contains basically disaster relief provisions. I want to talk about that. So this is partly an update on where we are in terms of actual policy, and it's also then some things it tells us more broadly about social insurance. So I'm going to go back to my screen here and move on to the CARES Act. There are several pieces. This isn't all of them, but these are the major pieces that probably matter. Everybody was supposed to get stimulus checks, which was something that loomed very large in the public discussion. But I think at this point so we gave everybody some money and we hope that they spend them, but the problem is not lack of demand. And that's not enough money to provide people with very much relief during this crisis. We have the Payroll Protection Plan, which is interesting. It's a program of loans to small businesses. There's also other loans for large businesses, which I suspect is actually not going to matter very much one way or another, because they mostly are able to borrow anyway. But we get loans to small businesses, which can be turned into grants if the businesses can show that the money was used to maintain payroll. And so, at least in principle, it's kind of like a US version of the subsidies that some European countries have been giving to try to maintain employment, basically subsidizing businesses to keep workers on the payroll. So that's a interesting policy. And then we took unemployment insurance. Unemployment insurance in the United States is notoriously both extremely limited in coverage and extremely limited in the scale of benefits. Most people who lose their jobs don't get unemployment benefits, and those who do get only a fraction of their previous income replaced. Well, the CARES Act temporarily greatly expanded the range of jobs for which unemployment benefits are available, and it hugely increased the amount of money, $600 a week supplement to the basic UI, whatever the original level in your state was going to be. That's a lot. That's enough so that for a significant number of US workers, they will get more under unemployment benefits than they would have received in their regular employment. That's a very, very big step. I mean, put it this way, if you were working a 40-hour or less week, this is the equivalent of more than $15 per hour. So it's well above the minimum wage. Now, you have to show basically the usual criteria for unemployment. You can't just quit your job and then say, give me my unemployment benefits. You have to have been laid off. But that's a really big deal. So how do these two pieces work? So here's a live action shot of the payroll protection plan. It's actually not. It's actually a drawing of the Oklahoma land rush. Payroll protection plan was disastrously badly designed. Aside from whether the conceptual notion of loans that can turn into grants is right or not, the way it was set up was not as an entitlement, not as meet these criteria and your business gets a loan, and here's how much you get. It was set up, there were criteria, but there was actually a fixed amount of money. They then topped it up there. They added a second tranche, but still, it was a fixed amount of money to be allocated not by a federal agency, but by private banks, and on a first-come, first-served basis. So the Oklahoma land rush, for those who don't know their U.S. history, the United States, when it opened up the territory of Oklahoma to settlement, anyone who wanted could get a 160-acre farm on a first-come, first-served basis, and the way you had to stake your claim was to physically occupy the farm site. So there was an opening. There were people who snuck in before, but the basic thing was they held people at the border of the territory, fired an opening gun, and there was this mad dash as people raced across the terrain looking for promising-looking farm sites. And that's basically what happened. The PPP money was exhausted almost immediately. Who won the race tended to be firms with good connections to banks, not necessarily firms that really needed the money. So it was a disastrously designed program. Unemployment insurance was not. It's an entitlement. It's not something where there's a limited pot of money. And the criteria are clear, and the allocation of the benefits, when you meet those criteria, you get them. So they didn't outsource the allocation. What they did do was to run it through the existing unemployment insurance system, which turns out to have at least initially been a big problem. The United States has the unemployment insurance is run at the state level. States differ in the generosity of their benefits, although there's heavy federal contribution to the cost. And the state unemployment offices were administratively overwhelmed. They were just not ready for this large a surge in claims. Now, partly that was by design in some states. The policy has been to make it hard to collect unemployment benefits. The theory that encourages people to be lazy or something. And so the offices were, by design, had too much red tape, inadequate administrative capacity, and so on. But even in states that are relatively friendly towards the welfare state, the mechanics were just not good enough. So I am, by the way, what you're seeing is me quarantining in New Jersey. The state of New Jersey put out an appeal for people who knew how to program in COBOL, which is, if there are any young people watching this, you have no idea what that was. COBOL is a basically defunct programming language, business programming language, that nobody younger than me knows how to use. But the infrastructure, the computers that run New Jersey's unemployment system are so outmoded that they still run on COBOL. So that gives you an indication of where we were in terms of this. And so for the first few weeks, there was overwhelming evidence. There was huge amounts of anecdotal evidence and quite a lot of other evidence that Congress might have voted unemployment benefits, but people weren't actually managing to claim them. And that's probably still true to some extent, particularly in the states with the worst service, Florida again. But it's starting to look as if that program is kicking in. So I'm going to do a share again. So this is not new claims. There's a bunch of statistical stuff. New claims turn out typically overstate job loss, probably because the systems are so difficult that people end up applying several times. But these are people who are actually getting benefits. That has risen by an amount comparable to the number of jobs we think is lost, which suggests that in fact, after some lag, the unemployment benefits have more or less kept up with the rise in unemployment. So as long as this goes on, we are in fact delivering a large benefit. I would say that the unemployment benefits are the core of the actual relief that we've provided. There are some major holes. What would you want to be doing? First of all, you actually do want an effective small business lending program, and maybe even large business. You want to preserve businesses in being so that they can rehire if and when the virus subsides. You also want to maintain the U.S. federal government is able to borrow, as far as we can tell, effectively unlimited amounts at a very low interest rate. State and local governments are by and large barred by law from running budget deficits. Now, there's wiggle room and all that, but basically, programs should include fiscal relief for lower levels of government. It did not, that April jobs report showed that 1 million state and local workers have been laid off, and that's already, that's just the very leading edge of that. That's going to have all kinds of adverse impacts. Of course, Stone Center is at CUNY, which is a state basically owned by the state, but effectively a joint state-city institution and facing large budget cutbacks. So that's crazy. That's a disastrous failure of policy to be doing that. So there were major holes, and the holes that worry me now are that besides that, state and local, the UI expansion, it ends on July 31st. And you really worry, is this Congress going to renew it? Because it's extremely unlikely, I would say, given everything we can see about the situation, that we will have made substantial recovery by that point. So lots of reasons to worry. But anyway, we have a program, and the core of the part that seems for the moment to actually be working is this expansion of unemployment benefits. So let me go back to slides. This was actually making the point that I just made verbally. So we've had 20 million jobs lost. The bulk of them are in obviously high contact sectors that we need to shut down for the time being. So that's leisure and hospitality, retail trade, this remarkable fact of declining healthcare employment, 2 million jobs lost in a pandemic, but that's because people are not having dental work done. They're not doing elective surgery. They're not doing routine doctor's office visits. But the one on the right is different, which is government. And that's all state and local. So there's 1 million jobs because the relief packages did not provide for that. Okay, this slide is where I want to be concluding this, is the question about design of the welfare state. I've had an amazing number of people saying, so now that we have all of these people losing their jobs, doesn't this make the case for universal basic income? Everybody gets a check from the government unconditionally. In fact, it makes exactly the opposite case. It makes the case for targeted benefits, which you can see if you start to think about this unemployment insurance component of the relief we provided so far. It's a great thing. We are providing people with substantial income support, $600 a week. If that were maintained for a full year, it looks like a pretty good bet that it should be, because we're nowhere close to being epidemiologically ready to reopen the economy. And if we reopen too soon, which unfortunately looks highly likely right now, then we'll pretty soon see a spike in cases and have to shut it down again. So this period of depressed employment will actually go on longer, be self-defeating. If it was to go on for a year, that would be $30,000 a year to each unemployed individual. If we had some kind of basic income, that would mean that every non-elderly adult would receive that grant unconditionally. And if we were, and there's about 200 million non-elderly adults in the US. So an unconditional grant that provided the same level of benefits would cost $6 trillion a year, which is about 30% of GDP. Even if you're a big government person, to say, okay, let's expand government by 30% of GDP, it seems like a bit much, and it's not going to happen. So anything that was unconditional would have to be much less generous, which would mean much greater hardship for the workers in these sectors that have been shut down than is actually happening. Given the policy response so far, we're actually doing much better than we would have done with universal basic income. It would not deal with this because we have so much horizontal inequality of a peculiar kind here, basically sectoral inequality in the impact of the coronavirus. That's something which doesn't take that into account, that just provides a benefit that's, that would be broadly equalizing, is just going to fall vastly short of providing the kinds of relief we need. How much does all of this carry lessons for practical policy, also philosophy, if you like, of policy? One thing I would say about the COVID-19 economic crisis is that it really, in a way, makes the case for calling welfare state programs social insurance a lot clearer, a lot more. It's less of a stretch to call it that. When we talk about programs that help those that lower in the income distribution, it's hard. Many people think of, well, if you're a low earner, that's because you did something wrong or something. Here, the blow is falling upon people who just happen to have been in the wrong sector. Now, it turns out that those are disproportionately low-wage workers, but that's not the core of it. The core of it is just people who happen to have been working in the wrong sector. At some level, all of us who support, who care about inequality, and all of us who support a strong welfare state are Rawlsians. We like to think about, what society would you choose if you didn't know who you were going to be? What would you choose behind the veil of ignorance? And the veil of ignorance is a lot less hypothetical in this case than it is normally. You can really see that who knew that we were going to have a crisis that would shut down the hotel business, but not legal services. So you can really see the case why people should be willing ex ante to agree on programs that provide a very strong safety net for those who fall upon misfortune. And this just didn't really come out of nowhere, but almost nobody was really prepared for it. And it turns out that the social safety net makes a huge difference here. If it goes away, we already, because of those delays in getting out unemployment benefits, we're already seeing huge lines to food banks. And if the unemployment benefits are allowed to expire before the crisis goes away, which I'm afraid may happen, we will see it again, and it's going to be a lot of desperation out there. So that's what we see, and it also it tells you that although it's testing for need, means testing, although what's happening now is not exactly means testing, but it's unemployment benefits is sort of situation testing. But prove that you need this because you were laid off. not this check comes to you as a matter of right. Um, I don't like it. We all think that Social Security and Medicare, the really among the great virtues of those programs is that they don't require any intrusion. You don't have to prove. You don't have to prove anything. You don't have to uh, do some kind of confessional. You're not. There's no prying into your personal affairs. It just this is what you get. But for many problems, you can't do this. So this is the best illustration I've seen of the case for means testing, or at least situation testing benefits, and it's a massive one. It does suggest that we do need to pay a lot more attention. I think those of us in the international economics area already realized that we were thinking too narrowly about inequality by only focusing on the distribution of income, and basically shocks to the Gini coefficient, if you like, and not thinking enough about things like what happens to communities. Well, here we're seeing what happens to whole occupations and industries in a crisis, and the standard ways we think about inequality fall short. And so, this is probably not the only case. So when we want to think about things like the impact of technological change going forward, it's probably worth trying to ask ourselves not just what does this do to the average real wage of workers in the bottom quintile, but asking to what extent is it having large differential effects on workers who just happen to be in the wrong place at the wrong time. And we should have known that. So anyway, so I think we've learned a lot, and hope for a better policy response. But there we are. This is where we are right now. One hell of a thing. Who knew this was coming? But a lot of good research work being done. I guess that's this very small saving grace. Thanks.